Hello everyone, I'm Dr.Deepshikha. I'm a physical therapist and our topic for today will be what are the various exercises for lungs post-COVID or for mild to moderate COVID affected people. Now, the main goal of our breathing exercises are to improve the ventilation inside the lungs, number one. Number two, it improves the strength, the endurance, and the coordination by decreasing the work of breathing and improving the strength of your inspiratory muscles. It reduces the stress and it leads to relaxation also. Then it also tells the patient how to deal with dyspnea. Dyspnea is shortness of breath. So mostly people in this condition they suffer from dyspnea, then inflammation, joint pains, fatigue is there, and weakness of the body. So with the help of these breathing exercises, you can actually improve your lung capacity and help in improving your health more so that further complication does not take place. Before starting your breathing exercises, make sure that your shoulders are relaxed and do shoulder shrugs, so that you can relax your accessory muscles and your shoulders. Okay, sit in a relaxed position, then start with breathing exercises. Breathing exercises help mobilizing the sputum, also known as pelgum. Now basically sputum are those secretions which are present inside our lungs. Now if the sputum amount is more, it leads to infection. Now, I will firstly talk about your diaphragmatic breathing. The best position to do your diaphragmatic breathing is either in lying down position, or you can sit and you can do also long sitting position. Now, while sitting position, what you have to do is simply in diaphragmatic breathing, you have to reduce your chest activity and increase your abdominal activity. For that, place one hand over your abdomen, take a deep breath, feel as if your tummy is coming out, just like a balloon. When the air is filled in, it comes out. Then blow out from your mouth and tuck your tummy in. Again, breathe in. Breathe out. Now in diaphragmatic breathing, you have to take care of one thing. You don't have to exert yourself. You have to do this breathing slowly. Take slow inspiration and breathe out and improve the abdominal activity. Okay, diaphragmatic breathing. Second is your pursed lip breathing. Now the main thing under pursed lip breathing for diabetic patients, since your pursed lip breathing can also lower the sugar levels inside the body, which can actually lead to hypoglycemia. So specifically for the sugar patients and for depression patients as well, you have to, just after this exercise session, after like 15 minutes, you just have to eat something. Okay, so in pursed lip breathing, you have to breathe in slowly for the count of 2. And breathe out for the count of 4. Make sure that whenever you're breathing out from your mouth or you're doing expiration from your mouth, it should be slow. It should not be forceful. Because if you will do this forcefully, then what will happen? The bronchioles, the small bronchioles which are present inside your lungs, will constrict more and leads to narrowing. Because of that, it will further lead to shortness of breath. So you have to be very careful while doing pursed lip breathing. You have to repeat it for 3 to 4 times. Okay, so again, we'll do this. Alright, so this exercise, clasp your hand behind your head. When you breathe in, open your chest, breathe out, bring your elbows together and bend forward. Alright, so repeat this exercise 3 to 4 times. Make sure that whenever you are suffering shortness of breath, always bend forward, whether you are in standing, whether you are in sitting. And the best position is lying down on your tummy, which is also known as prone 9. One is with the help of your assistive device like your respirometer, also known as incentive spirometer. There are various forms of it. So I am using this one. Here you can see it's written your 600, 900 cc and 1200 cc. You have to connect it with the help of the pipe, and there is a mouthpiece. Make sure that different person use different mouthpiece for the exercise, and you have to keep it in front of you at 90 degrees. You can use a pillow and rest your arm on it. Keep it like this and just inhale. Okay, so whenever you are inhaling, all these 3 balls should go up. And similarly for expiration, just turn it upside down and blow. Okay, so whenever you blow, these 2 balls will go up. Remember that whenever you will do inspiration in this, these 3 balls goes up for individuals who doesn't have any kind of chest infection, for people who are not suffering from any kind of respiratory diseases. And in expiration, the 2 balls goes up for the people who are not suffering from any kind of infection or respiratory diseases. Okay, so all these exercises can be done thrice daily, and these exercises can be done post COVID-19 as a lung strengthening exercises. These exercises can be done by normal individuals also who wants to increase their lung capacity. Also, these exercises can be done by mild to moderate COVID-19 patients. These exercises needs to be done 45 minutes after eating your meal or 45 minutes before eating your meal. So always make sure that there is a gap between your meal and your exercises. And for any further information, you can message or you can contact me on my email ID, which is drdeepshikha.thakur@gmail.com.